G'day everybody, Dr. Drew, Big Man talking. Today I thought I'd spend a few minutes and pump out a little bit of motivation, particularly around the aspect of care and what care means to people, particularly people who work in the care industry. Because the reality of what I see every day in the care industry is that not everybody understands what care is or what care does. And for people like myself who work in care, I know that there is a true value in it, and particularly that true value is not necessarily is care work as simple as just all about giving care to somebody. So when I think about care, I always think about acronyms and words, and I'm going to break them down for you. So let's go with the C in care. The C in care means a number of things to myself as a carer and a health professional. It means that I need to focus on my client, or my customer, or my consumer, however they are determined these days. It means I must be focused on that person and that I must understand them individually and holistically. It also means that I need to collaborate as a C word, and I have to collaborate with other people, not only with the family of the person who I'm caring for, but also other health professionals and other people that they have delivering services in multi-modes around them. And the other C word I think to focus on around care would have to be the word of compassion, because the reality of giving care is that you have to have a heart, okay, and you have to care about the people that you care for. You also have to care about the people and respect the people in that group, in that collaboration, because we all need to share that compassion to deliver the best outcome to the client. So thinking about the A word, for me as a nurse myself, I think about assessment. Assessment is incredibly important when we start to think about our clients and the journey we take with them from the start of meeting them and developing a knowledge around their healthcare needs. With assessment, for me also comes another A word, which is action. And for me, the action is the doing. And there's lots that we have to do for people in care. There's lots that we have to do when we start to assess as health professionals or as care workers. And there's lots that we have to do to get things into place to set up the care environment or the care project, program or process that we offer. And the other A word that I like to look at when I think about care and teach care to people is the word accountability. And it's an important word because every step of the process we take in care, we're always having to be accountable for the actions that we take, for the things that we do for people, and specifically for the decisions that we may have to make. And you can move this from down at the care worker level all the way up to the senior healthcare professional. But along that journey, everyone should have an accountability for the service that they provide. So moving on to the R word or the R words in care, I look at responsibility because it blends with everything we've already discussed. And responsibility is something that we take on. Around care work, it is not as simple as just washing and bathing and feeding of the activities of daily living. Blended into all of this are the layers of law and ethics, the principles that sit around what guide us in care. People have an expectation in the service provision of care, and with that comes the law and the ethics that sit with it. From a healthcare professional's perspective, I think of the word review and revision because it's always good, and reflection because it's always good to go back, review what we're doing, reflect on process, and constantly think about our plans, our service, our delivery, and whether or not the needs of our clients are being met through the care process at any one time. And probably one of the most important legal and ethical requirements as an R word in care would have to be reporting. And here I talk about documentation, the accountability and the reporting of things that we do, and recording the aspects of care that we offer to people, keeping things in a continuity and in a flow, and things that be counted and measured along that way. So there's a good R word to remember and always record and report. Finally, we reach the E word in the letter, or the E letter in the word care. And for this, it's an important letter for me because it starts with empathy. And empathy is really all about having an understanding of the needs of your client and feeling with them and knowing exactly what it is that they are setting goals for and wanting to achieve, or what we are able to educate, supply and deliver to them to help them move along the process towards wellness. We have to always, in that empathy, understand equality. It's a shared responsibility, care, because we're not just servants. Carers are not servants. Nurses are not servants. We're not handmaidens. We don't just service people. And we specifically like to think as ourselves as equals to our clients and the people we care for. And we like that equity to be shared. So it is again a responsibility and a respectfulness, but it's about empathy and equality for me, that the carer and the care worker or the care person share an equity and they hold responsibility to it. Evaluation, of course, is a big thing for health professionals. I like to evaluate what I do as a group in that collaboration we spoke about up at the C words for care, and go around and reflect and look at everything we do as a case conference, and to make sure we get it right. Another E word would be education. It's really important that people understand that people who work in care and deliver care as a service are paid for that in a general place, and are health professionals to a point, or if not registered to a board such as the APRA. But education is important. It's a two-way street. It's the education and the quality of the education that is held in the person giving the care, whether it be from Certificate 3 all the way up to diplomas, degrees and masters and PhDs. There has to be an education wrapped around what we do to give it quality. And of course, our patients need and deserve to be properly educated and informed so they can make choices around the care that's being offered, or they can make choices around the care that they don't want being offered. And perhaps it's important to staff and clients to build again that collaboration and compassion we spoke about back in C, that this is an aspect that needs to be focused on. That is, education is key to getting good care outcomes for everybody. It's respectful, it's holistic, and it allows us to have substance to what we do. And really, I think the last E word for care for me is expectation. People who receive care as a service have an expectation. What that expectation is something we learn through our assessment and our understanding of our client, but also the people who deliver care have an expectation. These expectations are things that sit around respect, around goal setting. Where are we going from here and where are we going to there and how are we going to get there? Involve a number of things that care work, as I've explained today, has processed in it. And goal setting is one of those things, because if we can't meet those expectations, things may have to change. And of course, in care, that's where we collaborate, that's where we redo our assessment, that's where we review what we're doing, and that's where we have empathy and we have equality and we start to build better care goals for people to reach and things that are achievable. So I'm going to end this with this little thought again. I ask everyone to share this video and get it around and give a few people a look at this understanding of what care really means to some of us who do it every day on a daily basis. Okay, think about the people who give care or work in nursing homes or work in disabilities or in community services. And I want you to remind yourself when you see them, care work is more than just a job.